Welcome to Women Lead, a production of the Women of Color Empowerment Institute. We are your hosts. I'm Bernadette Norris-Weeks.
And I'm Kathy Eggleston. Today, we have a topic that is growing faster than many people realize, the medical AI revolution.
Artificial intelligence is no longer something from a science fiction movie. It is helping doctors diagnose illnesses, predict health risk, improve patient outcomes, and expand access to healthcare in ways that were unimaginable just a few years ago.
Yes, but Bernadette, as AI becomes more integrated into medicine, many questions remain. How will it affect patients? Will it improve health equity? Can it help address some of the healthcare disparities that disproportionately affect women and our communities of color?
To help us understand this rapidly evolving landscape, we are joined today by a physician, entrepreneur, and thought leader who is passionate about improving healthcare outcomes and empowering patients through innovation. She is Dr. Latisha Rowe, physician, entrepreneur, and health innovator. We can't wait. Stay tuned. We'll be right back after these messages.
You were made for this moment. September 11th through the 13th in Fort Lauderdale. Join hundreds of women of color at the Empowerment Conference. 3 days of purpose, power, and progress. Early registration ends August 16th. NationalWomenOfColor.com.
At the Women of Color Empowerment Institute, our mission is to enhance and expand leadership by women of color. We do this in a variety of different ways, including but not limited to providing mentorship opportunities for young professionals where we assist in helping to create paths to leadership. We empower women to develop capacities for social change. We produce programs that promote heritage awareness, and we provide training opportunities for business and government. Our institute holds seminars focused on professional success techniques, and we host many other events such as our popular Advocates for Change and Leaders Connect. The Women of Color Empowerment Institute publishes a magazine called Women Lead. Our signature event is the Women of Color Empowerment Conference, a yearly conference where hundreds of leaders gather from all across the United States and beyond. To learn more about membership and how you can support our programs or be a sponsor of the Women Lead TV, visit us at NationalWomenOfColor.com. Again, that's NationalWomenOfColor.com.
The law office of Austin Pammies Norris Weeks Powell is a full-service law firm practicing in the area of governmental law, including the representation of municipalities, civil litigation, personal injury, real estate, and corporate transactional matters. With over 100 years of collective experience, our attorneys are admitted to practice before state courts, federal courts, and the United States Supreme Court. We are conveniently located in downtown Fort Lauderdale and can be reached at 954-768-9770. Or for more information about the law firm of Austin Pammies Norris Weeks Powell, visit our website at apnwlaw.com. That's apnwlaw.com.
We are excited to welcome Dr. Latisha Rowe to Women Lead. Dr. Rowe is a Miami native. She is living in Houston, Texas right now, right? With her own practice. And she has an expertise in telemedicine, Kathy.
Absolutely. And today she is here to help us understand about artificial intelligence and its intersection with medicine and our communities. So Dr. Tish, thank you so much for coming.
Thank you for having me. It's a pleasure.
Definitely a hot topic, Dr. Tish.
Absolutely, absolutely.
All right, so I want to start out with asking you a foundational question. So for those who don't necessarily know what artificial intelligence really is, tell us about it and tell us about its intersection with medicine and our communities.
Absolutely. So artificial intelligence is a computer helping you to think. That's how I like to think about it for people who maybe don't understand the subject. how it is intersecting with medicine right now is in every aspect. It really is moving at lightning speed. Artificial intelligence is being used in the exam room and it's being used in the boardroom. They're using it to make clinical decisions and financial decisions, and both will impact your overall health. So it's important to know that this is happening and it's affecting you right now, whether you realize it or not.
Interesting. Many women are concerned about receiving timely diagnosis. How is AI helping physicians detect diseases early and more accurately?
We've been using artificial intelligence a lot earlier than people realize. They have put artificial intelligence up against doctors to diagnose disease and found that it's as good as or often better. Some examples would be putting pictures of your eyes into a computer and seeing, can the computer diagnose the retinal disease, or would the ophthalmologist not diagnose it? Would the computer diagnose the disease or the ophthalmologist? And they found that they're equally good. They've done this with radiologists, giving them pictures of x-rays, CT scans to see, can the computer diagnose as well as a radiologist? And we know that the answer is yes. So absolutely, it's being used in many different ways, from imaging to diagnosing. And I think you all will find interesting, being in the legal field, there's even a bill for artificial intelligence to be able to prescribe. So to act as a physician.
Oh my goodness.
Yes, I don't have the bill, but it hasn't made its way up, but it's there.
And
it's proposed.
It's a little scary also because AI does hallucinate.
Yeah,
So.
it does.
And now you mentioned that artificial intelligence is running through the background of many places in healthcare, including financial decisions, insurance decisions. Tell us about some places AI may be running that we don't even know about.
I think what people might not realize, I'm a family practice physician, so I see patients every day. So practicing for 10 plus years, I'm used to just having to come up with a treatment plan on my own. Right now, I can see you, take notes in my computer, and dump all the information and say, hey, give me a treatment plan. I would then review that treatment plan and decide, do I agree with the computer? But it's in a split second, right? Versus me taking a few minutes to think, okay, how do I want to do this? From a patient perspective, you should know that your doctor is using AI to come up with your treatment plan right now. And there's nothing wrong with that as long as they're experienced and they're also backing that up with their own knowledge, not just simply taking what the computer has to offer. That's on an individual level. On a system level, the hospitals and clinics are taking those doctors' individual decisions, and they're going to then use that to say, how do we come up with algorithms for treatment? If 100 doctors treat this way, let's make this a protocol and plan. And that can be good or bad because communities of color don't always need to be treated the same as everyone else. So it's a plus, I think, for your individual doctor, but then we have some concerns when it comes to applying that data to communities and systems.
Well, that's a good point. And of course, we're the Women of Color Empowerment Institute. That's who we are. And women of color often experience disparities in healthcare outcomes. Can AI help to close some of those gaps? And if so, how?
Absolutely. So as a family practice physician, I see patients 9 to 5. On the weekends, I'm reviewing labs, I'm reviewing orders, I'm reviewing prescriptions. Patients' biggest frustration is you taking too long to get back to them. I want to know, what are my lab results? I want to know, what does this prescription do? I want to know all of these side effects. Too often when it comes to communities of color, we're not seen or heard. So we may raise concerns that are dismissed. Now, if you feel you're dismissed, put that information into the open AI platform you choose. I use ChatGPT a lot, but there are others there, and put your question in there. And I encourage you to challenge your doctor, because if they're not using AI also, that's a problem. So I think the best way that it can be used for health disparities is not allowing yourself to be dismissed because the doctor knows more than you do. Because now, truthfully, if you use technology to empower you, then you know as much as the doctor. Now, it's very important that AI is not personalized. So your doctor, if they've known you for 5-10 years, they know things about you that you have not put into AI. So still trust them. But I think that is the most important thing, the thing that I see, the thing that I hear from people of color who come to me, especially after not having a African-American doctor or a doctor of color. They feel like other doctors don't listen, other doctors don't hear them. And I think it's a real and valid concern because people think if you don't have a certain level of education, then do what I say because I've gone to school for 15 years. And that's simply not right. You know your body and you know what you're feeling.
The law office of Austin, Pammies, Norris, Weeks, Powell is a full-service law firm practicing in the area of governmental law, including the representation of municipalities, civil litigation, personal injury, real estate, and corporate transactional matters. With over 100 years of collective experience, our attorneys are admitted to practice before state courts, federal courts, and the United States Supreme Court. We are conveniently located in downtown Fort Lauderdale and can be reached at 954-768-9770. Or for more information about the law firm of Austin, Pammies, Norris, Weeks, Powell, visit our website at apnwlaw.com. That's apnwlaw.com.
At the Women of Color Empowerment Institute, our mission is to enhance and expand leadership by women of color. We do this in a variety of different ways, including but not limited to providing mentorship opportunities for young professionals where we assist in helping to create paths to leadership. We empower women to develop capacities for social change. We produce programs that promote heritage awareness, and we provide training opportunities for business and government. Our institute hosts seminars focused on professional success techniques, and we host many other events such as our popular Advocates for Change and Leaders Connect. The Women of Color Empowerment Institute publishes a magazine called Women Lead. Our signature event is the Women of Color Empowerment Conference, a yearly conference where hundreds of leaders gather from all across the United States and beyond. To learn more about membership and how you can support our programs or be a sponsor of the Women Lead TV, visit us at nationalwomenofcolor.com. Again, that's nationalwomenofcolor.com.
Now, I want to ask you specifically about women and maternal health, because we have such a disparity in our community, and babies and children. Can AI play a positive role in that situation?
I think absolutely. So when it comes to maternal health, what separates family medicine from other specialties is we're actually trained in maternal health, OB care, pediatrics, and hospital medicine. So I spent a significant amount of my training on the OB ward, delivering babies. So when it comes to maternal health, I think the biggest thing is trust. And a lot of women of color may seek care later because they have not found a doctor they trust to start their care. And we've also learned to distrust hospitals because we see the difference in maternal mortality when it comes to us. So the first way I think that AI can be helpful is matching patients with providers in their areas that they trust. Instead of you spending weeks or months trying to find an OB, if we can have platforms for AI that says, here's the wait time for these OBs in your area, here are the ones that match your needs. I have not seen that on the market yet, but I think that's going to play a huge role. Unfortunately, due to decreasing reimbursements, even here in Miami, we've seen some of our biggest maternal wards close. And now patients are going to have to drive longer and further to get that maternal care they need. So I think in terms of AI, strategically planning your birth plan, right? How far are all the hospitals from you? I think those are ways that it will come in. Now, once you're admitted and in the hospital, I think hopefully we'll see where AI is able to help review the strips, because we see mothers are dying in childbirth, delayed care when there are negative outcomes. So hopefully when it comes to, and when I say strips, just to explain, when the baby is being monitored, oftentimes the way we know if the baby is okay, we're looking at an electronic strip of that baby's internal movements. So if we have AI in addition to doctors doing that, we should be able to detect negative outcomes faster and act on those outcomes faster as well. Because as the number of hospitals and the number of doctors decrease, now you have one doctor maybe responsible for reviewing 30 strips. And sad as it may be, I feel that oftentimes we'll be the last ones to get the care we need in those situations. But if AI is there to make sure everyone is prioritized the same, regardless of color, I think that can be a game changer. So I think from maternal care to delivery, AI can become really helpful in creating solutions.
Some people worry that technology will replace the human connection in medicine. As a physician, how do you see AI enhancing rather than replacing the patient-doctor relationship?
It's a double-edged sword. So the answer that many people may not be comfortable with is, in some instances, it will replace the human connection, but that's not necessarily a bad thing. Physicians are currently developing their AI twin, where they are cloning their thoughts, their decision-making, their voice, and their person. So in 10 years, you may be able to see Tisha 2.0, right? As a doctor. It's happening now. It's not something that's far off. But why is that possibly a good thing and not a bad thing? Because doctors are completely burned out. We've created a system where doctors are expected to see 20 to 30 patients per day based on a fee-for-service model, where the only way you can survive is based on volume. And by the end of the day, the human connection you're getting, if it's burned out, that's not necessarily a good connection. So I think that AI will enhance that, because you're going to have options. You're going to be able to decide, do I want to wait an hour in a doctor's office, see a doctor that didn't have lunch, didn't have a bathroom break, and is looking at me like they're done with life, right? Or do I want this digital twin?
That's happy.
A lot of people don't want to think about that, right? But if it truly is personifying your doctor and the fact is being checked, I don't think that's a bad thing. But let's stay where we are now. How is it enhancing that experience? Doctors are able to close their notes faster. No doctor wants to have to go home and do charts over dinner, right? Not see your family on the weekend because you're so inundated with prescription requests. So we're using AI to do refills. We're using AI to review your labs. So that allows the doctor to have more time just to connect with you and to listen to what you're saying. The AI scribe is listening, creating the note, and then creating the plan, and the doctor can review it. So now the doctor is able to be more present. So I think in those aspects, it is going to replace the human connection eventually, and it's something that patients need to be prepared for, but not necessarily in a negative way, the way most people will want to frame it.
September 11th through the 13th in Fort Lauderdale. Join hundreds of women of color at the Empowerment Conference. 3 days of purpose, power, and progress. Early registration ends August 16th. NationalWomenOfColor.com.
At the Women of Color Empowerment Institute, our mission is to enhance and expand leadership by women of color. We do this in a variety of different ways, including but not limited to providing mentorship opportunities for young professionals, where we assist in helping to create paths to leadership. We empower women to develop capacities for social change. We produce programs that promote heritage awareness, and we provide training opportunities for business and government. Our institute holds seminars focused on professional success techniques, and we host many other events such as our popular Advocates for Change and Leaders Connect. The Women of Color Empowerment Institute publishes a magazine called Women Lead. Our signature event is the Women of Color Empowerment Conference, a yearly conference where hundreds of leaders gather from all across the United States and beyond. To learn more about membership and how you can support our programs or be a sponsor of the Women Lead TV, visit us at nationalwomenofcolor.com. Again, that's nationalwomenofcolor.com.
The law office of Austin, Pammies, Norris, Weeks, Powell is a full-service law firm practicing in the area of governmental law, including the representation of municipalities, civil litigation, personal injury, real estate, and corporate transactional matters. With over 100 years of collective experience, our attorneys are admitted to practice before state courts, federal courts, and the United States Supreme Court. We are conveniently located in downtown Fort Lauderdale and can be reached at 954-768-9770. Or for more information about the law firm of Austin, Pammies, Norris, Weeks, Powell, visit our website at apnwlaw.com. That's apnwlaw.com.
Now, I want to make sure that we ask you the question about ethics and AI. And I know that it is important for people of color and communities of color to be included in training AI. Otherwise, they won't know us and they will make up things about us. But you have issues of medical privacy, et cetera, et cetera. So talk to us a little bit about ethics in AI and how you see it.
I think that you're absolutely correct. We've seen this in research. Communities of color are traditionally not included in research. The research comes out, that's how they decide what medications to prescribe, what dosing to use, and it often does not work for us because we're not included. I think it's very important that communities of color are included when it comes to training AI models, but realistically, I don't think that's happening. One of the things I did when I saw the changes coming, I enrolled in Harvard's AI healthcare certification. There were very few people that looked like me, and this was a course that was virtual and around the world. So I think for us to be included in that training, that we have to be very intentional, from doctors to people in politics to making sure that we are at the table, because it's not going to happen by osmosis. They're not just going to say, hey, we should include them because that's the right thing to do. We have to show up. We have to be at the AI conferences. We have to talk to the institutions we work for and say, hey, how are you making sure communities of color are represented when you're doing this? Otherwise, we will be left out and left behind and just left to deal with the consequences.
Doctor, what excites you most about the future of AI in healthcare?
I think what excites me the most is the opportunities for innovation and scale. There are doctors that I know personally developing apps right now that can transform healthcare, myself included. So with that, I think that we're going to see healthcare delivered better. We're going to have a better healthcare system, whether it includes diet, exercise, and nutrition being a part of the healthcare visit, whether it's decreasing wait time. So what excites me is that for the longest time, we've all collectively agreed healthcare sucks and have made very little change to improve that. But I think we're coming into a time where AI is really going to allow physicians and other stakeholders other than the people at the very top to be the change makers. And I think that's exciting.
Dr. Tisha, daughter of Miami, homegirl, ice cream parlor in Opelika. Mama had an ice cream parlor in Opelika. You are so cutting edge. And we already said you are not only a physician, but an entrepreneur and creator. tell us about you and some of your business projects.
Absolutely. So I'm the founder of Honeycomb Clinic, which is a medical co-working space based in Houston, Texas, going to be expanding. And we actually use AI to help match doctors with the right places for them to practice. And we focus on communities of colors, placing doctors of color in communities of color. That is my bread and butter. I'm a family practice physician. I see patients. I love seeing patients. That's what I do. And I'm also the founder of the Boss Doctors Conference, where we empower doctors to learn about the business side of healthcare, to innovate, to invest, and to create.
So before you go, I want you to talk a little bit about what women should know about protecting their personal health information as AI becomes more common in healthcare.
Absolutely. I think the most important thing is to know how your data is being used. You show up to a doctor's office, it's very common that you have to sign a privacy practice. That means that we're not allowed to share your data without your permission. But the truth is, once we remove your name, date of birth, and other information, your data is being shared. And it's not only being shared, it's also being sold. So I think when it comes to protecting your information, don't be afraid to ask that question. What data sharing options are you using, and how is that data being used? There's actually a little button that you check when you're registering a patient, allowing you to share data with other institutions. Why that's important is I may need a copy of your mammogram. I may need a copy of your colonoscopy. But if it then is used in other ways, developed and sold, I was told years ago, the value of one person's health data is about $15,000. That's what you call health capital. So if a doctor has 5,000 patients and that data is being sold, it's being used in a way that's going to generate profit. So I think most importantly, do not email your health information to anyone. Emails are hacked every day. We know that. Make sure when you go to a doctor's visit, you ask them what data sharing is being used and for what purposes. And don't be afraid to say, please don't put my data into my personal information into any AI systems. Because if your doctor is using AI to come up with a treatment plan, it's very important that they're not uploading like the actual mammogram document that has your name, your date of birth, that can be used in court, can be used in other ways if that's subpoenaed. So be in control. Don't be afraid to ask, and don't be afraid to say, do not share my data.
Wonderful.
Wow, this has been so enlightening. If Dr. Latisha 2.0 is anything like Dr. Latisha 1.0, sign me up.
I'm telling you, and I think 1.0 is probably going to be pretty consistent there, but I'll take the 1.0. But thank you so much for joining us today. This has really been a pleasure, really informative.
So enlightening.
Yes.
My pleasure. Looking forward to Women of Color.
Awesome. Well, she's going to come back to the conference. So yay. Come to the conference. And that's our time today, folks. And until the next time, be empowered.